In this video, we are going to learn about autism. And you're watching this video because you're concerned about autism in your child or someone in your family. So my name is Dr. Rahul Bharat. I am a pediatrician and I have about 26 years of medical experience, and I specialized in neurology and neurodisability. For the last 11 years, I've been helping children and families with autism. And this video is to clarify some of the common misconceptions that people might have about autism. So when we say autism, we have to use a diagnostic criteria. And the diagnostic criteria for autism usually is a deficit in their social communication. So what is social communication? So social communication is agenda-based communication. The child would like to stay in their own agenda, and if opportunities are to communicate in their agenda, they would communicate better. But outside their agenda, or if they have to follow other person's agenda, then they might show more difficulties. So the difficulties can be seen in their social interaction. So social interaction is measured more by looking. So when we interact with someone, we look at them, by listening and looking, as well as understanding the situation to say what is their agenda, and then talking. Speaking is after looking and listening. And with talking also, we develop more negotiation skills to ensure that the other person is also able to understand what we want and how we can work together. So social interaction usually is a deficit for them, but the social communication is a bigger deficit for them. This is a big issue when it comes to making and maintaining relationship, because sometimes they get overwhelmed with situation and the friends are unable to understand their behavior. The other difficulty, which is very peculiar in autism, is restricted and repetitive activity pattern and behavior. So restricted would means that they can talk but they might not talk. Restricted would mean they can eat a certain thing but would like to eat certain other things. So they are restricting themselves with how they play, how they interact, how they talk. All of these are restriction behavior, and they might develop strong preoccupation to some things and like to do that for a long time, sometimes in isolation. So these things are usually with non-living toys, objects, maybe non-toy objects, sand, water. They will develop a compulsion to do a repetitive activity and behavior with that. So this has to be present. Along with that, they can also show body movements. They can also show sensory avoidance behavior, like difficulty in a noisy place, brushing teeth, hair cutting, eating certain things, smelling certain things, climbing heights. So if we see that there's a pattern of these difficulties in childhood, in early childhood, and the child is showing significant deficit in their social communication, social interaction, maintaining relationship, as well as restricted and repetitive activity and behavior, only then we move towards a diagnosis of autism. And this diagnosis must be made in different environments, such as school, such as home. Unless and until it is in different environments, we should not give a diagnosis of autism. So when we say a diagnosis of autism, usually a medical professional will ensure the child doesn't have an associated medical problem, such as a brain injury, or such as a genetic problem, or an epileptic encephalopathy, which means an epilepsy in the background, which can change the behavior and make the child restricted and repetitive. So these things the doctor should be able to identify and ensure that this is just a neurodiversity without a genetic problem, without a brain injury. There are other things which are affecting the parent, such as, is it a deficiency of a vitamin, or is it something that you can sort out by giving any medication? So these are the things the doctor should be able to check by looking at the size of the head, by looking at the pattern of their physical development, by looking at their developmental milestones. And not all the time you will need a medical test or a scan of the brain. So these things can be easily done by a medical qualified professional. So every time a diagnosis of autism is done, we ensure that the doctor has seen and ruled out these things. Once we make a diagnosis of autism, the other question you would have is, how severe is my child's autism? So it doesn't depend on if the child is talking or not, or if the child is doing daily activities. It depends on, number one, associated medical problems. So if there's a brain injury, it is more severe. If there's an associated genetic problem, it is more severe. If there is more epileptic encephalopathy as well as autism, it's going to be more severe and it's going to affect more severe impairment for the child. So severity would mean, what are the impairments 10 years down the line, 15 years down the line? So those markers are, number one is associated comorbidities. The other thing is that in a child with autism, usually the way to understand them is to say that there is a green pathway and there is a red pathway. So if the child feels that the environment is adverse, they start using the red pathway and they will ignore simple things in their environment. So if they are ignoring, they develop a repetitive pathway, which is the way by which they can overcome their anxieties. So if a child has autism, you will see lot of adjustment behavior, lot of ignoring behavior, lot of repetitive behavior, lot of dysregulation behavior, where the body is compelled to do certain things. The body is not controlled by the mind. That's why its body is dysregulated. So when we see a child with autism, we should not just see what they are doing, but also look at the red pathway behavior, also look at their dysregulation, and these should be measured. And if over a period of time these goes down, the impairments are less. But if you are just focusing on the child's activities, talking, play, then the child will have the red pathway behavior at the same time as well as the green pathway behavior. And because of that, you will see that there will be more impairments in the child's life in the future. So a lot of severity questions has to do with the understanding of parents to say, this is how the child's brain works. The child has some strength. The child could have a strong visual memory. They would remember what they have seen. The child could have a strong attention to detail. And the child can show a strong personality and determined personality. They would like to do what they want to do. So if you have a diagnosis of autism, don't panic. What we do for you is we do a proper profiling and tell you what stage is the child, what pathways they are using, and what you can do to move to the next stage. So in the brain, it's all about moving to the next stage and the next stage and the next stage, finally to a stage where the child is using the green pathway, using their strong memory and a strong personality, determined personality, and not using the adjustive pathway. The long-term difficulties in autism is high level of anxiety, which would give a lot of restricted and repetitive behavior as well as obsessive behavior. Some children can develop psychosis. So it's very important to understand that an autistic mind could be overburdened, could be using the alternate pathway, the red pathway, and it is the environmental modification, which is the goal, and ensuring that we are not doing exactly opposite of what we need to do. So I hope this was useful. Thank you.